Hit record. Hi everybody, Dr. Woeller here for Great Plains Laboratory. This is the monthly webinar sponsored by Great Plains Lab. I'm Dr. Woeller from Integrative Medicine Academy. So I thought for this month's talk would get a little bit deeper into the organic acids test. It's one of my favorite topics. I've actually pulled some information from a course I have on this topic. So first off, if this is the first time you've heard me speak, I'm Dr. Woeller. I've been an integrative and functional medicine physician for over 20 years, about 23 now. And I've been doing a lot of clinical education for Great Plains Lab through these monthly webinars. Been doing this for many years. And then I also teach their organic acid test seminar in person here at the United States, as well as internationally. I've written a number of books. I'm a practicing clinician. I'm co-founder of Integrative Medicine Academy, which I'll talk about here shortly. Just jumped ahead, sorry. Also the medical director for a new website we have coming up called Functional Medicine Clinical Rounds. And then for over 20 years, I've been working with the autism community, as well as working with patients with autoimmune, neurological disorders, and GI problems as well. So if you have taken one of the seminars from Great Plains Lab on the use of the organic acid test, then you've probably heard me speak. So through their GPL Academy, in fact, we just did a 3-day seminar this past week. So where I go through kind of the introductory aspects of learning how to interpret the OAT test. And we know how important the OAT is. I think it's a game changer in practice if you learn how to use this test to, even half of its potential can be really transformative for your practice and for your patients. My first introduction to the organic acid test was right after I attended an autism conference back in, 1998. And when I first did the test, I really had no clue what I was looking at. It was totally overwhelmed by all the markers. I actually had a consult with Dr. Shaw, and he kind of walked me through some of it. And, I kind of, stumbled and fumbled with it for a number of years. And it really wasn't, but I kept at it. It really wasn't until a number of years after that I started to dig deeper into what this test was all about, particularly when you're starting to look at some of the more rare markers that are linked to genetic problems and mitochondrial problems. And so now it's become such a focal point in my practice as well as our teaching programs that I'm really excited to be able to present this information for you and just encourage all of you to keep digging for answers. So Integrative Medicine Academy is an online training academy for healthcare practitioners that we started about 4 years ago. We've got a number of courses available online, including autism, toxicity, functional medicine, as well as hormone. And then this past year, starting back in 2019, we launched the Advanced OAT Mastery Course. And this is an extremely detailed online course on advanced topics in organic acid test interpretation and clinical implementation. So in this particular course, we go through every single marker on the test. Some we know are quite common, as I touch on in the GPL Academy course. Some are rare, but still there's links that can be made to various health issues, and there's always another level to learn when it comes to this type of testing. This course is actually currently ongoing, so we're about 3 modules into the 12-module course, but it's available for access at any time. And so even if you're listening to this or you were at the weekend workshop, you can join that course and have plenty of time to catch up. And actually what we're doing based on this past weekend's course through the end of this Sunday, which would be June 21st, we've extended the special discount pricing for the purchase price of this course. You just need to use what's called OAT Workshop promo code. So if you go to advancedoatmasterycourse.com You can read all about the course there, and you're interested in it, you can use that OAT workshop promo code. This is for new registration. If you want to get some more information about the course too as a link, you can text the word AOAT to 66866, and you'll get this special report. So AOAT to 6686, it'll send you a link that you can download the special report on the OAT test. And then I'm really pleased to announce that we're launched this new website called Functional Medicine Clinical Rounds. So this is a resource website for ongoing education in functional and integrative medicine. So there are bi-weekly videos that get created that highlight anything from case studies to clinical pearls to research article discussion to lab test reviews. Also, this service allows for practitioners to also have one-on-one consults with myself and my practice partner, Dr. Trenkatella, through the lab review service. So if you have lab tests that you would like reviewed, if you want a clinical, troubleshoot cases, this website will provide for that. Also, members of the site will get discounts on other courses through Integrative Medicine Academy. So more information, you can go to functionalmedicineclinicalrounds.com. So one of the key elements of all of our courses, and one of the key elements of this talk, and whatever you're doing with regards to the organic acid test or other tests you're doing in your practice, my whole approach in teaching is to think critically and think clinically. And it's not just about treating some of the markers on the test, but it's how those markers, what that means to the person who's sitting in front of you, looking at things clinically, thinking of them critically, as well as then using the test as further reinforcement for either your clinical suspicion or to confirm that there is some underlying biological problem. And we know that the organic acid test can also be a jumping off point, meaning that there are markers on the test that give us suggestions or hint that there may be other problems going on, whether that's issues related to chemical exposure, perhaps problems related to mold toxins, etc. So what I'm going to do in this talk is we're going to go a little bit deeper into this topic, and I'm going to highlight a few things off just a few sections. We'll touch on a couple things in the bacterial markers. I'm going to show you some additional information on Clostridia bacterial markers. We'll talk a little bit about things linked to the pyrimidine metabolites and where folate might fit into certain scenarios. What's the link between the fatty acid oxidation section and the mitochondrial section? And even some additional things with regards to a marker in the indicators of detoxification section. Okay, and then as well as the amino acid metabolites. So first off, let's look at just bacterial markers in the intestinal microbial overgrowth. So we know that these markers in this section can indicate dysbiosis, some kind of bacterial imbalance in the digestive system. Hyperic is a marker that tends to show up quite commonly. What you have to decide is it clinically relevant? Is it problematic? What does it mean for the person that it's showing up elevated in? Usually by itself, it may not necessarily mean a problem. In context of other markers, it might be elevated because of some type of imbalance. That would certainly make sense the more markers there are on this section of the test, in association with DHPPA or even in association with 4-hydroxybenzoic or 4-hydroxyhyperic. Hyperic is actually a conjugate. It's the joining of chemical compounds between glycine and benzoic acid. And benzoic acid can be produced from various biochemical reactions. It can actually get produced because of bacterial metabolism in the digestive system. Most commonly, and that's one of the key elements about the OAT, is kind of trying to look at what most commonly is happening, what's the most likely scenario. it's mostly produced from the digestive system bacteria breaking down something called chlorogenic acid, breaking down chlorogenic acid into benzoic acid, which is then excreted in the urine as hyperic acid. And hyperic acid, okay, again, can come from this metabolism of chlorogenic acid. Chlorogenic acid is a phenolic compound, so it contains a benzene ring with a hydroxyl group that can be linked to coffee and other types of foods. And so what you may be looking at when the hyperic is elevated on the organic acid test is you may be looking at increased bacterial activity in the digestive system based on somebody's diet. And it's interesting because chlorogenic acid actually has antioxidant activity. It can be also linked to the consumption of other foods. As I mentioned, coffee, blueberries, cherries, carrots, apples, peaches. So again, if it's elevated, you need to kind of look back and say, well, what is this person's diet? Do they drink coffee, etc.? And again, is it clinically significant? Benzoic acid is also found in cranberries and cranberry juice. What's interesting about chlorogenic acid in association with other types of acid, caffeic acid, also something called 3-phenylpropionic acid, is these things work in unison and have anti-colon cancer activities. So in many regards, just because it's elevated doesn't necessarily mean it's an issue. And what you, again, most cases, at least that I've seen, is it's elevated because what appears to be increased bacterial activity in the digestive system. I've even seen hyperic high as well as DHPPA high be elevated in people who are just taking probiotics, for example, who don't really show evidence of dysbiosis or irritable bowel or whatnot. Could it be possibly linked, let's say, to something like small intestinal bacterial overgrowth? Well, maybe. By itself, probably not, but the more bacterial markers you have elevated in this section, that certainly is a possibility. But as I've mentioned before, if you've heard me lecture, I personally don't use the organic acid test as a definitive test for small intestinal bacterial overgrowth. It might certainly suggest that possibility, but in order to make that diagnosis in the classic way it's defined, you'd actually need to do SIBO testing for hydrogen and methane. That doesn't mean you couldn't initiate treatment based on the OAT findings, but again, if you're looking for that specific diagnosis, you'd need to do additional testing. Another marker that's kind of interesting that shows up from time to time under the bacterial markers section is 2-hydroxyphenylacetic or 2-hydroxyphenylacetic acid. And 2-hydroxyphenylacetic is produced by overgrowth of bacteria in the digestive system, primarily through the metabolism of tyrosine amino acid. It has been associated with enteritis as well as celiac disease. Could you definitively say somebody has celiac disease just because 2-hydroxyphenylacetic is elevated? No. You need to do additional testing to confirm it because there's other reasons it could be high. It's also a marker that can be associated with phenylketonuria. Phenylketonuria being a metabolic disorder in children, and many times, obviously, when kids are born here in the US, they check them for PKU, and PKU can have serious consequences in a newborn, leading to, brain damage, etc. Does the elevation of 2-hydroxyphenylacetic acid on the OAT diagnose PKU? No, but if it's elevated along with other markers linked to phenylalanine metabolism, it certainly suggests that there may be a problem in phenylalanine metabolism. PKU, essentially what happens with these kids is they get elevations of phenylalanine, phenylpyruvate, phenylactate, phenylacetate, or phenylacetic acid that is elevated in the blood, and then it also is elevated in the urine. And one of the things is this musty smelling or musty odor to the urine that is described in these kids. In severe cases, it can lead to neurological problems, from seizures to mental retardation to tremors. Also, these kids end up getting hypopigmentation issues. Melanin is interesting, is that it actually has a link to tyrosine metabolism, phenylalanine being linked to tyrosine as well. So there is some kind of block or blockage happening in phenylalanine metabolism that's leading to these problems. If you go to the last page of the OAT, page 5, there are some markers in the amino acid metabolites section that's also linked to phenylalanine metabolism problems. Phenolactic, phenylpyruvic, and even mandelic, although mandelic can also be elevated because of styrene or styrofoam exposure. So if you see these elevated, it's telling you that there's some issue happening in phenylalanine metabolism. But the reality is if you're doing OAT testing in adults, right, it's not likely that they have phenylketonuria, but they may have some kind of blockage, some kind of defect in the enzymes that control phenylalanine, specifically phenylalanine hydroxylase, because phenylalanine hydroxylase is the enzyme that converts phenylalanine to tyrosine. So if we have a bacterial section where 2-hydroxyphenylacetic is elevated like we see here, but the phenolactate, the phenylpyruvic, those markers on the amino acid section of the last page of the OAT are normal, then you're primarily looking at some kind of bacterial imbalance. Okay, that would be the most likely scenario. So you always have to ask yourself the question, what's most likely happening? What's most likely happening in this scenario? So we've got a 3-year-old child. Okay, now they've had a PKU assessment done when they were newborn, and it was normal. We've got hyperic, that's high. We've got 2-hydroxyphenylacetic, that's high. We've got 4-hydroxybenzoic, that's elevated. Now it's interesting, we certainly could say that they've got some kind of dysbiosis. The hyperic could very well be linked to diet, probiotic use, for example. Is the 2-hydroxyphenylacetic linked to PKU? Well, if we come down and we look under the amino acid section of the OAT, phenolactic is normal, phenylpyruvic is normal. Those two are very specific to PKU. So the chances of PKU existing here are minimal. The 2-hydroxyphenylacetic is being linked to some kind of dysbiosis condition in the gut. If we throw in a couple other markers here, the 4-creosol and the 4-hydroxyphenylacetic, these are linked to Clostridia bacteria. Now, what's interesting about 4-hydroxyphenylacetic is it is linked to small bowel problems. So it's certainly possible in a case like this that we could have small intestinal bacterial overgrowth, okay, but we're not dealing with some kind of genetic problem of phenylketonuria, even though the 2-hydroxyphenylacetic is elevated. Clostridia bacteria. Let's talk about a few additional considerations. I've mentioned in many of my webinars, as well as the OAT seminars and my other training, that expect to see a fair amount of people who come back elevated for at least one Clostridia marker. About 20–25% of OATs that you'll see in your practice, regardless of age or diagnosis, will have at least one elevation of one of these markers, the most common being HPA. Second most common is 4-creosol. Third most common is 4-hydroxyphenylacetic. It's relatively uncommon to get all three of these. We know that creosol is linked to C. difficile. We know that 4-hydroxyphenylacetate is linked to C. difficile and other Clostridia. I've also discussed the resilience of Clostridia problem and how difficult it can be to treat in some individuals, and it tends to have a very high recurrence of infection. And so the spores of Clostridia, again, are resilient too. In fact, they're not killed off by antibiotics. Spores aren't killed by common disinfectants. Alcohol wipes can actually spread spores in the environment. It takes very high temperatures, over 241 degrees Fahrenheit, to actually kill spores. Bleach can kill spores, but that's not something that's advocated for oral consumption or even long-term consumption. I know there's people out there that probably have questions about chlorine dioxide, for example, but that can be for another discussion. It certainly will have an effect on Clostridia, but where people get into trouble is long-term use of some of those things. And yes, I know fecal microbiota transplant, these other therapies are out there too. Those can be helpful. But one of the things I just wanted to mention now is the fact that spores make Clostridia very, very challenging, and the spores themselves are very sophisticated. As the Clostridia spores are entering the digestive system, entering the small intestine, as they're moving through, they're starting to transform themselves into what's called a germination phase or outgrowth phase. So by the time they hit the large intestine, they're producing a wide variety of toxins that greatly affect what's happening in the bowel. But it's the germination phase of this transformation that makes the Clostridia vulnerable to treatment, whether it's with antibiotics or botanicals. And we went through a lot of this in the OAT seminar that I do for Great Plains, and we also talk a lot about this through the Advanced OAT course that I have through Integrative Medicine Academy. So this information actually comes from part of the Advanced OAT Mastery Course, and that spore activation of Clostridia, the process where the spore is being transformed into this germinative phase, this metabolically active phase, is when the spore itself comes in contact with certain substances in the digestive system. These bacteria contain receptors. These receptors actually interact with amino acids and what are called nucleotides that can exist in the digestive tract to actually trigger germination. Clostridia difficile, for example, interacts with various amino acids as well as bile salt. And we know that we're producing bile salt, okay, from the liver. It's going through the common bile duct and is being released into the duodenum to help with fat digestion. And then most of our bile salt is reabsorbed back into our liver, back at the last part of the small intestine called the ileum, right before it, enters the large intestine through the ileocecal valve. And intestinal calcium and bile salts appear to be a trigger for Clostridium difficile germination, which likely then extends to other Clostridia as well. And so this particular research paper, and there's many others, actually are showing that intestinal calcium is a key molecule for initiating germination of Clostridia spores. It then begs the question, well, who might be susceptible to having excess calcium in their digestive system? One of the things this article talked about is that people who have poor digestion overall, people who are on proton pump inhibitors, for example, or other things that are compromising absorption, could allow for more calcium to basically be retained in the digestive system. One of those groups are people with vitamin D deficiency. Vitamin D deficient individuals are not absorbing calcium from the digestive system effectively. And so in the presence of Clostridia difficile exposure or other Clostridia, there's an increased chance for Clostridia spores being transformed through their germinative phase into metabolically active form, where they are now producing large amounts of intestinal toxins. So it's another consideration when thinking of intervention for people. One of the things that gets when you start looking at this kind of research is, is it advantageous to actually have people take calcium, for example, to maybe try and initiate spore transformation? Some of this stuff is at this point research-based, but I wanted to share that with you as an extension of things that I talked about through the GPL Academy course, is that some of the factors that are somewhat unavoidable for us, because our liver is going to be producing bile, and we consume calcium through the foods we eat. There's going to be some aspects of this that we ultimately can't control 100%, but there's definitely some deeper clinical considerations there marching forward. Let's switch gears to the DOPAC in dopamine discussion under the neurotransmitter metabolites. So we know that dopamine gets converted to norepinephrine from the dopamine beta hydroxylase enzyme, and that enzyme is dependent on a good amount of copper as well as vitamin C. DOPAC is this go-between. It's this metabolite of dopamine that eventually becomes homovinylic acid. Homovinylic acid can be measured on the OAT as well as DOPAC. Now, the main reason DOPAC was added was in attempts to try to, see perhaps if somebody could benefit from what's called S-adenosylmethionine supplementation. So a number of things can lead to elevated DOPAC. We could have a deficiency of S-adenosylmethionine. We could have a polymorphism of our catecholamine O-methyltransferase enzyme. We could be increasing dopamine either because of intake of phenylalanine and or tyrosine, or we could be increasing dopamine that's spilling over to DOPAC because we're blocking the dopamine beta hydroxylase. So those are all different scenarios. S-adenosylmethionine is important because it has a relationship to many things biochemical, things at the nuclear level within our cells, relationships to phosphatidylcholine, which has relationships to, actually has relationships to liver function with regards to bile formation, as well as the function of our cell membrane. So it's a key component of the methylation cycle. In fact, some people call it the methionine cycle. So as you convert homocysteine to methionine up the front end of methylation, you have to convert it back to homocysteine to the back end of methylation, or what sometimes is called the methionine cycle. And that has a relationship to SAMe or S-adenosylmethionine. So what could be causing elevations of DOPAC? A polymorphism in the dopamine beta hydroxylase, some genetic deficiency, an abnormal variant in dopamine beta hydroxylase activity might lead to it as well. One of the reasons you're doing the organic acid test is to check for Clostridia toxins, because we know that HPHBA, 4-creosol, and probably even 4-hydroxyphenylacetic could be an inhibitor of dopamine beta hydroxylase activity. Vitamin C and copper deficiencies could lead to low activity of the dopamine beta hydroxylase as well. One of the interesting things about Clostridia, particularly the P-creosol and the HPHBA, is they bind very strongly to the dopamine beta hydroxylase. And they do so in an irreversible fashion, which means that once they bind, this particular enzyme is rendered inactive. Okay, and remember, it's the dopamine that gets converted to norepinephrine through dopamine beta hydroxylase. So many times you have to look and think, well, what could be affecting that enzyme? Is it Clostridia? Well, I can measure that off the OAT under the Clostridia section. Could there be vitamin C or copper deficiency? Well, there might be, but you'd have to test for those things separately. The vitamin C marker on the organic acid test really isn't accurately reflective of a deficiency of vitamin C. It's commonly low because vitamin C or ascorbic acid in urine samples degrades very quickly. The main reason ascorbic acid is on the OAT is to pick up on elevated levels. Is the dopamine beta hydroxylase, is there some kind of genetic variant that could be affecting the overall function? Well, that's possible, but that would have to be tested for separately as well. In most cases, the dopamine beta hydroxylase is being inhibited by Clostridia. So what happens if you actually have a number of things going on? Let's say there's a scenario where you have some kind of genetic variant in dopamine beta hydroxylase, which slows down its function. At the same time, you throw in some Clostridia difficile. At the same time, you have a patient taking either tyrosine or phenylalanine because they think that they need that for whatever reason. Well, you could end up having really a catastrophic problem, because the more you block dopamine beta hydroxylase, the more you drive up dopamine, the more you're going to drive up HVA. At the same time, you probably also start to see an increase in DOPAC as well. And one of the things I've mentioned before is that too much dopamine in the nervous system can be toxic, because 90% of dopamine that's stored in the terminal vesicles of a neuron, okay, is doing so. It's basically kept in check. 10% of it's sitting out on the cytosolic fluid, and small percentage shifts in that cytosolic dopamine is enough to induce a toxic effect through a breakdown product of dopamine called dopaminoquinone. Dopaminoquinone can trigger apoptosis of nerve cells. It can also lead to glutathione deficiencies, as well as lead to neurodegenerative reactivity within the nerve cell as well. So the OAT helps us to identify certain problems, and then through our own knowledge and investigation, we'll suggest doing additional testing to try to figure out if there are other problems that may be affecting some of these systems. Low DOPAC is something that shows up from time to time. Okay, it's not as common in my experience as high DOPAC, and there's a number of reasons to be low. I'm going to focus on one of those right here called BH4, Tetrahydrobiopterin. We often talk about methylation in isolation. We think sometimes of these biochemical systems that they sort of exist on their own. We know that that's not the case, but it's a convenient way to teach, or it's a convenient way sometimes to conceptualize these things biochemically, but there's a massive overlap between these complementary systems. So the methylation cycle is linked to the folate cycle, is linked to the BH4, what's called the biopterin cycle. A lot of attention is focused on MTHFR, and for good reason. MTHFR is a chemical bridge between the folate cycle and the biopterin cycle. The biopterin cycle actually has a direct relationship on neurotransmitter levels. Neurotransmitter levels linked to dopamine, neurotransmitter levels linked to serotonin. And it's because BH4 acts as a cofactor for tyrosine hydroxylase, for phenylalanine hydroxylase, as well as tryptophan hydroxylase. A lot of attention is many times focused on the C677T variety of the MTHFR gene. The A1298C is interesting too because it actually has a strong relationship to other things other than folate. One of the things it's involved in is augmenting BH4, or what's called Tetrahydrobiopterin. And we know that off of genetic testing. This is a panel that Great Plains has. It's also linked to doctors' data. That a fair amount of people, I see a fair amount of autistic kids have, excuse me, either heterozygous or homozygous mutations in their MTHFR A1298C. And this is the one that has a strong relationship to things that you sometimes can see on the neurotransmitter section of the OAT. BH4 is a cofactor for the conversion of phenylalanine to tyrosine, tyrosine to dopa. Okay, and it's also linked to serotonin as well. Chemically, it's linked back to something called pterin or pterins. And a pterin is this heterocyclic compound that contains different ring structures. One's called an amino group, another's called a keto group. Basically, you've got ammonia linked to these ring structures with a double bonded oxygen. Folate is actually a derivative of pterins, and pterins get complexed into something called biopterins, which then get complexed into tetrahydrobiopterin, or what's also known as BH4. And BH4 is a cofactor for these hydroxylase enzymes. Phenylalanine hydroxylase, which converts phenylalanine to tyrosine, tyrosine hydroxylase, which converts tyrosine to L-dopa. We know that L-dopa then goes on to become dopamine, and tryptophan hydroxylase, which converts tryptophan to 5-HTP. So here's just another graphic representation of this. Tyrosine to catecholamines, dopamine, tryptophan to serotonin, melatonin, phenylalanine to tyrosine. This also has a relationship to citrulline and nitric oxide. If we expand this discussion, think of this. Tyrosine gets converted to L-dopa, which goes to dopamine. Tyrosine is also a precursor to melanin, or, obviously the pigmentation in our skin. It's a precursor to CoQ10, which has a relationship to the Krebs cycle, particularly the electron transport chain. It's a precursor to thyroid hormones. So anything that affects tyrosine metabolism could affect a number of different systems in our body. We've already discussed a little bit about PKU, right? Phenylketonuria, where we have a blockage in converting phenylalanine to tyrosine. Well, BH4, or tetrahydrobiopterin, is a cofactor to make phenylalanine get converted to tyrosine. In fact, BH4 is a supplement. It also comes in medication that is often used in PKU, so that we're not getting a buildup of phenylketonuria, which we know can have toxic effects on the brain and nervous system. And we know that if we get a buildup of phenylalanine, it can lead to elevations that can be seen on the OAT. Phenylpyruvic acid, phenylactic acid, under the amino acid metabolite section, page 5. And then there's that 2-hydroxyphenylacetic, which is found under the bacterial section on page 1. There's some clinical suspicions of poor BH4 support. One of the things that this is linked to is potential high ammonia. There is a marker on the OAT called orotic acid under the indicators of detoxification that can be linked to ammonia excess. Low thyroid function, low energy, poor focus problems. But things you can pick up on the OAT would be more things like low dopamine, which would mean low HVA, low norepinephrine, okay, and also low serotonin, the 5-hydroxyindoleacetic, the 5-HAA. It's interesting in autism, there's often this focus of what kind of supplements, what kind of things might be helpful for speech. And, you know, there usually isn't just one thing that helps speech. Speech is a very difficult problem in autism, quite very, very common. And so there's not, you know, these specific speech supplements. But one of the things that has been shown from a research standpoint is that Tetrahydrobiopterin, or BH4, has been associated with speech initiation in some individuals with autism. I mean, I've seen that happen with B12 and folinic acid and L-carnosine and other things as well. But this particular article was focusing on about 5 major things, BH4 being one of them. So when you're looking at an organic acid test under the neurotransmitter section, when you see low levels like this, we've got somebody that's got low dopamine, or low normal dopamine, we've got low norepinephrine, and they also have low 5-hydroxyindoleacetic. What's most likely the scenario? What seems to be the problem? Is it possible this person could be severely amino acid deficient, so they don't have any of those amino acid precursors to even fuel the system? Phenylalanine, tyrosine, or tryptophan. That's certainly a possibility. Somebody would have to be extremely malnourished and very low, I think, in order for that to be a real possibility. And so it's possible in a scenario like this that one of the prevailing issues may be a deficiency of tetrahydrobiopterin, which isn't something that at least I know of that can be tested for directly. So there are things that the OAT shows us that says this is a likely scenario biochemically. What can we do about it? Because the reality is in integrative and functional medicine, sometimes you just have to try different therapies to see which one hits the mark. So it's not, you know, out of the realm of possibility here that a person like this could actually benefit from BH4 supplementation. And I've actually used BH4 in autism with some good effects. And one of the effects it has seemed to have is an improvement in speech and language complexity in some individuals. But because it's a cofactor for phenylalanine, tyrosine, as well as serotonin, you can also get a boost, again, in the function of those neurotransmitters, which could mean improved attention, less hyperactivity, less irritability, less depression, etc. Another interesting scenario as part of this discussion is the impact that yeast and fungal toxins have. This is a particular article, this came out a number of years ago, but one of the things it talked about was the relationship of certain fungal markers, like tartaric acid, for example, that may inhibit the phenylalanine hydroxylase enzymes, or just the hydroxylase enzymes in general. So it may be what we're looking at in some people is a fungal contribution to the neurotransmitter imbalances. But if you have low neurotransmitters on the OAT, and on page 1 all the fungal markers are normal, well, the neurotransmitter deficiencies aren't happening because of fungus. It's happening because of some other reason. There was an article that came out in, I think this was 2019, so just last year, on the role of mycotoxins in autism. And one of the things that was discussed in this article was that ochratoxin A, which is what the OTA is an inhibitor of phenylalanine hydroxylase. So again, you know, we're often looking for things like some of those fungal markers on page 1 of the OAT to you know, give us a strong suggestion that Aspergillus may be present. But remember, the OAT test isn't going to rule out the presence of mycotoxins. It's going to rule in that you've got gut colonization of Aspergillus, but you could still have somebody who's exposed to Aspergillus, who's still harboring elevated ochratoxin, but the oat isn't detecting the mold because the mold may no longer be present, but the mycotoxin that came from that aspergillus could still be existing in the body. Which is why I have now made the mycotox test one of my 5 core tests that I do initially in autism. Organic acid test, comprehensive stool analysis, food IgG to look for food sensitivities, a hair metals test, and the mycotox. Those are my initial 5 if I can get those done. I will always start with the oat if people can't afford to do all 5 of those. Fatty acid metabolites and indicators of detoxification. I've discussed in many webinars and many courses the impact that all of these things have on mitochondria. And this broader discussion is why I don't have a lecture in the OAT seminar just on mitochondrial dysfunction. In the Advanced OAT seminar, we do get into that in great detail. In the basic OAT seminar, we're basically approaching it the fact that mitochondria can become altered because of the presence of many factors, from oxalates to nutritional deficiencies, toxic chemicals, candida, clostridia, etc. One of the things I wanted to show you real quickly was fatty acid metabolism issues. If you look at the fatty acid and ketone oxidation section of the oat, many of these things can show up because they're inflated at a mild level because of diet. So I've shown examples where people were taking coconut oil, for example, cooking, and it just kind of caused these markers to be high. But every once in a while, you'll get a scenario where you'll see certain markers extremely high, like we have here, the 3-hydroxybutyric and the acetoacetic. You'll notice that obviously these 2 markers are very elevated. So these can be elevated because of a ketogenic diet, somebody who's got some kind of metabolic disorder, either diabetes, prediabetes, metabolic syndrome, for example, are certain possibilities, some kind of glucose regulation problem. Suberic is the most common marker on this section of the oat to be elevated, and most commonly it's associated with an overnight fast. Suberic is actually linked to oleic acid. Oleic acid is the most common fat stored in our adipose tissue. So somebody who hasn't eaten in a while will break down fat, and that can show up sometimes as elevated suberic. Adiptic most commonly is linked to gelatin consumption. Adiptic can be found in antacids, for example. So I've actually seen it elevated a lot in kids who either eat candies, for example, Jell-O, whatever it may be. So what's happening in a scenario like this? Well, 3-hydroxybutyric, can be elevated like other ketones. It's actually linked to ketosis in people who have diabetes. In fact, 3-hydroxybutyric is often used to monitor diabetic ketoacidosis. So 3-hydroxybutyric can occur in the body primarily through liver production as a secondary fuel source for the brain, particularly when glucose levels are low or glucose can't be accessed because of insulin resistance or insulin sensitivity issues. Acetoacetic follows suit. Acetoacetic is produced by the liver under poor metabolic conditions, diabetes, for example, and it too is a secondary fuel source as part of gluconeogenesis. So when the brain is needing fuel to keep functioning. So our body is all about our brain. Our brain takes priority almost over everything. And so when our brain is deficient, it's going to require a lot of fuel to keep it functioning. So you can see elevations of 3-hydroxybutyric and acetoacetic in somebody as a reflection of some underlying metabolic problem. Okay, so it gets produced in the liver through the breakdown of fatty acids, and then it goes on to what's called extrahepatic tissues. Think of the brain, for example, as a secondary fuel source for energy production. Acetone, which is a spin-off of acetoacetic, okay, will actually make a person's breath smell like nail polish, which is something that can happen in people with diabetic ketoacidosis, for example. So a more serious manifestation. I remember when I was doing my internship and residency working in the ER, we periodically get people that would come in diabetic ketoacidosis. So what does that have to do then with what's going on in the indicators of detoxification section? If you took the OAT seminar this past weekend, or if you've taken an OAT seminar in the past, you've probably seen this slide that I've used to discuss just a little bit about the methylation cycle. So let me do that here. If we draw a line, above this line is our folate cycle and our methylation cycle, and they're linked right here through this methionine synthase enzyme. Below this line is transsulfuration. Now, we always have to think about what is most commonly going on. What's the most likely scenario? And the most likely scenario of increases of 2-hydroxybutyric, the marker right under pyroglutamic in the indicators of detoxification section of the OAT, the most common reason it's high would be because the body is trying to maintain glutathione levels. So as we need additional glutathione, it's going to pull on homocysteine through the transsulfuration pathway, push through cystathionine to help make glutathione. And part of that could be an increase of 2-hydroxybutyric. The transsulfuration pathway is also important for making sulfate to aid in liver detoxification, as well as bile salts, which help with that fat digestion and fat-soluble vitamin absorption. Okay, and so we discussed this at length during the OAT seminar. In fact, that's the most common reason that I feel people starting to use the OAT should recognize. But there are some other things that can be associated with 2-hydroxybutyric, and I'm going to focus right here on diabetes, for example, also alcohol use. But let's just focus on the diabetes because that's where we started this discussion. Notice in this particular case, our pyroglutamic is totally normal. So if you remember, pyroglutamic is elevated when glutathione is deficient, but 2-hydroxybutyric can be elevated for many different reasons. One of them being glutathione deficiency for sure, but we could be looking at somebody who has some underlying diabetic condition. 2-hydroxybutyrate or butyric is an early marker for both insulin resistance and impaired glucose regulation. It can be elevated in people with ketoacidosis or lactic acidosis, including diabetic ketoacidosis. And so another consideration as you take your knowledge deeper about the OAT and some of these markers is, does this fit the clinical presentation or what is the known history of your patient? Do they have a diagnosis of diabetes? Or is this somebody that is in line for prediabetes? Should you be considering additional testing and other considerations based on what you're seeing on the OAT? If you look at a situation like this, okay, we started with the ketone and fatty acid oxidation slide. We talked about how these two markers could be linked to some underlying metabolic problem. Okay, diabetes, for example. Lactic is a marker that is commonly discussed as being linked to mold exposure. So one of the things that I mentioned in the OAT seminar is if lactic is highest, another consideration of testing to do is the mycotox profile, and that still holds true. But we also know that lactic can become elevated because of an increase in these other organic acids that might be linked to some type of glucose intolerance problem, insulin resistance issue. So we can't definitively say that all lactic acid is from mycotoxins or all lactic acid is from, heavy exercise, for example. Based on our history and based on other markers that we're looking at, what are some other things that we might want to consider? Well, in this particular case, if we notice the pyroglutamic levels are normal, it certainly is a possibility that mycotoxins may be playing a role. And I would do a mycotox test for sure. But based on the history of this individual, this is an individual with diabetes, okay, poorly controlled. And so we're getting a reflection of 2-hydroxybutyric as well as the 3-hydroxybutyric and acetoacetic, okay, linked to their underlying metabolic problem. Sometimes you'll actually see subaric be elevated too in people who have poor metabolism. And so even the subaric kind of follows suit into this whole process because their body is basically breaking down fat as a secondary fuel source to help maintain normal function within the brain and nervous system because of insulin resistance and poor blood sugar control. Where's another step in somebody like this? Well, you could certainly, if they haven't had it done, look at serum glucose, fasting insulin, hemoglobin A1C. Okay, so anyway, that's just another consideration off of some of these markers that the OAT shows. This isn't something we talked about in the OAT seminar, but this goes to a deeper level here in how to assess some of these markers in context or in relationship to other areas on the OAT. And then there's one additional point of interest that I wanted to bring up. And that's riboflavin. So one of the things I've talked about before in the basic OAT class is that under the nutritional markers section of the organic acid test, you will commonly see elevations of glutaric, which are linked to an increased need for riboflavin or vitamin B2. And one of the reasons that that's high, at least this has been a very strong suspicion of mine because it seems to correlate very strongly with what's found on page 1 of the organic acid test, and that is that riboflavin is commonly, glutaric is commonly elevated on the OAT in the presence of candida and yeast elevation seen on page 1. And one of the suspicions biochemically is that acetaldehyde is a chemical that gets produced by yeast metabolism of glucose. We know that the end product of glucose metabolism of yeast is ethanol, but the step prior to that is acetaldehyde production. And acetaldehyde has its own problems. Acetaldehyde, for example, can inhibit the methylation cycle because it's an inhibitor of methionine synthase activity, which is the enzyme that helps convert homocysteine to methionine. So our body tries to get rid of acetaldehyde, and it does so through the interaction of various cofactors, one of those being riboflavin. So if you have a lot of yeast, there's a chance that your patient's going to be lacking in vitamin B2, as there seems to be an attempt to try to get rid of this buildup of acetaldehyde. But there are some other considerations with regards to riboflavin. Okay, and this is linked to things that you can see in the Krebs cycle section on page 3 that has to do with amino acid metabolism being linked to Krebs cycle function. And one example of this is this coenzyme dehydrogenase enzyme. It's a complex of enzymes, basically, that helps in the proper amino acid metabolism of tryptophan and lysine as they are moving towards Krebs cycle activation or citric acid activation. And glutaric acid is one of those things that can be elevated. Sometimes you'll see glutaconic acid elevated, which is also reflective on the OAT under the amino acid Krebs cycle section on page 3 of the organic acid test. Well, this enzyme requires flavine adenine dinucleotide. Okay, and this flavine adenine dinucleotide has a link back to riboflavin. Riboflavin, or vitamin B2, is found in many food sources: eggs, milk, dairy products, certain vegetables. And riboflavin acts as a cofactor in many biochemical reactions, including what's called flavin adenine dinucleotide and flavine mononucleotide activation. And these act as cofactors in various enzymes that are involved in fatty acid metabolism, as well as mitochondrial function. In fact, riboflavin has a direct relationship with mitochondrial activity. So again, we could think about what's happening at the mitochondrial level. Nutritional deficiencies or imbalances are a potent factor in mitochondrial dysfunction, just like candida, just like clostridia, just like oxalate, just like heavy metal toxins can also interfere with mitochondrial activity. Riboflavin plays a role in complex 2 of the electron transport chain. We talked about that in the OAT seminar, where succinic acid has a relationship to complex 2 as it's coming off of the Krebs cycle. Complex 2, in order for it to be active, needs adequate riboflavin in order to do so. Okay, and so if we've got a deficiency, it might interact or interfere with complex 2 activity. And if we interfere with complex 2 activity, we're not able to move things from one stage to the next in the electron transport chain for the ultimate production of ATP, which we all need to run the machinery of our body, including our nervous system, our heart, our digestive system, etc. Riboflavin has a relationship to the conversion of inactive folate. I shouldn't say inactive, but it has the relationship of converting and assisting our body in converting folate to 5-methylfolate or 5-methyl tetrahydrofolate. And where does this play a role? Well, our 5-methyl tetrahydrofolate is the form of folate that methylates cobalamin that's sitting within the methionine synthase enzyme for the conversion of homocysteine to methionine. So if we don't have enough riboflavin, we could also be compromising the methylation cycle. And if you expand this out even further, you see just one vitamin of how many different areas it plays a role. So it plays a role in the electron transport chain. It plays a role in activating vitamin B6. It plays a role in the Krebs cycle. It plays a role in fatty acid metabolism. It plays a role in the methylation cycle. It plays a role in helping to reestablish normal levels of glutathione. It even plays a role in proper tryptophan metabolism with regards to niacin, for example. So a lot of other relationships other than just linked to yeast problems. And so these topics and many others we get into in the Advanced OAT Mastery Course. The OAT Mastery Course, Advanced OAT Mastery Course, is a 12-module course that, again, goes through every single marker on the OAT test, at an in-depth level. So the course is available now for purchase. We're only 3 modules in. In fact, we have a couple-week break coming up, so we'll resume that course starting module 4 early July. If you're interested in learning more about the Advanced OAT Mastery Course, go to advancedoatmasterycourse.com. If you're interested in joining the class now, for new attendees, new registrations, we do have that promo code OAT Workshop, which is an extension of this past weekend's offer for $300 off the purchase price. And again, you can also get a download on the OAT course by texting AOAT to 66866 for this booklet. For those of you who are trying to access testing, not everybody has access to them. There is a website called Lab Test Plus. LabTestPlus.com offers many of the labs that Great Plains offers, as well as some other labs, including the organic acids test. So you can go to LabTestPlus.com and see what labs are offered. And then when those test results come back, by the way, they come back with a written interpretation of the relevant markers with what's called some action step suggestions. And then again, if you came on late to this presentation, I'm real excited about this new website that we have called Functional Medicine Clinical Rounds. This is an extension of our Integrative Medicine Academy. It's going to be a way for us to interact with practitioners one-on-one by doing one-on-one lab consults. So if you have labs that you want to discuss or cases you want to discuss with us directly, myself, Dr. Woeller, my partner, Dr. Trenkatella, you can do so through this website. There's also a 24/7 member forum for ongoing questions and answers. And then there are bi-weekly educational videos from case studies, clinical pearls, lab reviews. And we also encourage people who are part of this website, if they have a lab or they have a case they want to share with us and would like us to create a video for it as an upcoming lab review or a case study example, we're happy to do that as well. Okay, so functionalmedicineclinicalrounds.com for more information. And then I'm always available for private consultations through my practice, Sunrise Functional Medicine. Okay, that's the best email to reach us, scmedicalcenter@gmail.com. All right, everybody, thanks so much. I hope this was interesting information for you. I love talking about the OAT test. There's so much to learn with regards to this test. So I wish you well. Hope everybody's safe and healthy. I'm Dr. Kurt Woeller for Integrative Medicine Academy. Thanks so much. Take care.